As you can see there, the topic of today's presentation really it's family roller coaster, where in which really the idea is to try and break the cycles of ups and downs in addiction. I will first start off by just reading this opening statement that I've put down together. And then it goes, have you ever been on a roller coaster? That moment when your stomach drops, your heart races, and you realize there's no getting off until it stops. That's often what it feels like to love someone struggling with addiction. One moment there's hope, the next fear. One day you see progress, the next day relapse. Families often describe it as being trapped on an emotional roller coaster, which is full of highs, lows, twists, and turns they never expected to take. So the reason why I started off with that type of like an introductory statement really was to sort of like introduce the topic at large in terms of how we really are going to sort of like proceed as we continue with the presentation. We can move to the next slides. So some of the objectives that we'll really be looking at today is by the end of this session, families should understand the family roller coaster at large, what it contains, what really is about, learn the process of the roller coaster, how it starts and potential how it ends, know about the hidden themes of the roller coaster, things that might not necessarily be as direct, things that are more like indirect. So these most of the time are sort of like the impacts, and then lastly, we'll try and find hope or tools to cope, even though change might seem very much difficult in these situations. We can proceed. Okay, so I'll start off now with the introduction. As we all know, addiction is often described as a family disease because it doesn't just affect the person using substances, but it pulls in everyone who loves them. Families often ride a constant emotional roller coaster, of which is what I've sort of like alluded to in my introductory statement, which is hope, and then comes fear, and then disappointment, and then now you find yourself in a position where there is hope again. Now, the idea is as we continue, you should be able to understand these roller coasters I've indicated to see how it really does affects families, and of course to learn how to really step off the ride. So stepping off the ride also includes some boundaries that I've sort of like put them down together to sort of like help you. So I did have a bit of an example here, which then starts off from the hope element up until the disappointment part of it. I did indicate here that a father celebrates when his daughter leaves rehab. He feels certain she is cured in inverted commas. Weeks later, she relapses and his pride turns into shame and despair. This cycle repeats until he feels like he can't trust his own feelings anymore because there's a lot of, you know, emotional involvement that is there, especially as a caring, loved individual. For those, I mean, who are affected with the disease, that we tend to really be so excited, like anyone would be, when their loved ones either they leave rehab, and then we sort of like have this hope that they've done this recovery process, they've done these phases. But then what we often find is that if there is specific things that are not being followed into process, what then happens is the disappointment, the fear and the anxiety comes in. But you'll hear when I speak more about the emotional toll of this, because the anxiety forms part of a big element of it. It's a matter of, okay, are they really going to do this? How long will they remain sober? Will it just be another ride that I'm taking in and saying, mommy, daddy, baby, my love, whoever, sister, I promise that I'm going to remain sober this time. I'm committed to doing this. Before you know it, then you're back to the same process again. We can proceed. Okay, so we're just going to talk a little bit about the cycle, the family roller coaster cycle. As you can see in my picture there, I really did try to sort of like indicate in terms of what really am happening. So this repeating cycle often looks like this, like I have explained, hope. So in most instances, the hope elements basically refers to this time will be different. We do have loved ones where we know they've been to treatment facilities more than once, more than twice, more than 3 times, or even 5 times, or even 10 times, where now there's always this element of saying, okay, now they're being discharged, hopefully something will be different. So you still have that glimmer of hope that you sort of like hold on to. And then relief, most of the time you find that after discharge or after rehab, there is some sort of improvement that is notable. Maybe if this is also the individual who are struggling with maybe something to do with anger or anything that is really emotionally outside, then what happens in this space is you are likely to spot a change within the first few days, because really the idea is they've been to some form of treatment to get the help that they need. And then you got to sort of like sit with this sense of relief and be like, oh, okay, I think my uncle this time is actually at the right path. But even in then, when we have this hope and when we feel this relief, the fear is always there. What if they sleep again? Because really, the reality is addiction takes so much that we just don't want to see it happen again. We just don't want to experience it again. So when the fear comes in, and unfortunately with the fear part, it's not something that you can stop. It's common to everyone who has a loved one who has ever been to a specific facility. So the fear basically speaks about the worry or the concern that is there in terms of what if they sleep again? What if they relapse? What if they go back to their old self? Let me see how long now. This has been 2 weeks since discharge. It's been 3 weeks. Let's see if it's still sort of like a game or it's still sort of like a front. Are they going to go back again? Of course, the disappointment most of the time creeps in. It does not necessarily start with the relapse itself. Sometimes it's just going back to the old ways, the old behaviors that you've been actually exposed to, even in active addiction. Remember, they are not now no longer necessarily relapsed or they are back then. We can look at things like lies or manipulation. You start seeing the very same pattern now slowly creeping in. You'd be like, okay, I think you used to lie because you used to manipulate because of the addiction, but now even after rehab, it seems like the behavior is slowly coming in. Broken promises is also one of the indicators that then the disappointment element starts really to cripple in. Anger or sadness, it's actually exact emotion that you sit with after now a specific event has happened. This then can be just the relapse itself, or it just can be the behavior of manipulation or the broken promises, anything else that has been done. You can either sit with the anger or sadness. Like I've said there, it's feeling betrayed, exhausted, or even hopeless. But then here is the thing with this roller coaster. So most of the time, because we are the family, we really then try to be in that position where we try to help as much as we can, as often as we can, as best as we can. Now, even if it happens that the individual do sleeps, relapses, or go back to certain, ways, they're likely to also come back again. Be like, okay, no, I promise I'll change. I'll do things differently. And then what in turn happens is the hope redevelops. So we start having hope again. So it's more like the cycle just sort of like press a bit of resets with the new promises that are actually there. And then more often is we find ourselves in this cycle because we really are just families who love our addicted loved ones. There's a lot of ways that goes into saying, okay, you know what, we no longer want you, we're cutting you off, or anything like that. There's a lot of steps, there's a lot of measures, there's a whole bunch of things that have actually sort of like uh, been attended to or tried prior to eventually you take that step, because also it's just not as easy. It's very difficult to eventually say, I'm cutting you off, we're done. I did give a bit of an example here. I said a sister feels relief when her brother finds a job after rehab. She dares to dream he's back on track. So that's when you sort of like, okay, I think right now he's doing things accordingly, or you're seeing some slight improvements or some changes. And then when he spends his first paycheck on drugs, she crashes emotionally. Because remember, there's a lot of emotional investment that we really actually do as far as this roller coaster, or as far as emotions are involved in us really trying our best to care and love our addicted loved ones. We can proceed to the next slide. Okay, so now the question is, no matter how the cycle is being repeated or no matter how many times, we then find ourselves in the same position. Okay, up until maybe, I don't know how many times, when a loved one eventually says, okay, you know what, I'm done, I'm no longer doing this. But the biggest thing is what I've just sort of like alluded to now, is families love deeply and want to believe in recovery. Because recovery, we know it's really the only tool that's going to help our addicted loved ones. So now what happens is, most of the time, because unfortunately we live within societies, there is a lot of talks, there is a lot of, I don't want to call them facts because sometimes they can be disputed, but there's a lot of just these notions, these ideologies that are there. Hence, I put it there in point number two. I said societies generally tells families to stand by their loved one, but it doesn't explain really how draining it can be, or even steps in terms of how to go about it, how to deal about it. When now you find yourself in a space where you are actually emotionally as drained as you can. Now, families often mistake enabling for helping. This is also a big thing. I'm sure there's been previous presentations where enabling and helping or support has actually been, touched a lot. It's a big, big, big factor where you find yourself actually enabling the individual when you actually think that you are assisting them. Unfortunately, sometimes it's not as directly, sometimes it's not as intentional because we do everything out of love, but then we find ourselves in this, cycle of literally just sort of like maintaining or perpetuating rather the addiction that actually takes place in that space. And then the fourth point of why we actually stay on this ride, no matter how difficult, no matter how the journey is we basically just fear of losing the person. I think this is a big factor. When I was presenting on grief and addiction, if those were there, they can still remember how important it is, to really have their loved one at a safe space as best as you can. Sometimes even when we disown them, we still make sure that they're in a space where at least they can still get some necessary care. It's very difficult to completely just disintegrate. So fear of losing the person is actually a big, big, big factor, which then doesn't make it easier for one to sort of like disintegrate from them. And in most cases, we fear that the loved one might overdose. We fear that the loved one might end up in prison, or even issues around abandonment, really. Because that is why then when you look at that and you be like, there's a potential that the individual might end up killing themselves, might end up overdosing, or they might even end up being jailed, of which most of the time then you still need to be involved some way or the other. It's sort of like that thing that keeps them tied to hope and saying, okay, maybe if I'm involved and really try to care and support as much as I can, eventually change then will be sort of like inevitable. It will take place. I did give a bit of an example here. I said a wife hides her husband's drinking from the children because she doesn't want them to see the worst, which is then the behavior that we see once a person is intoxicated or under the influence. By covering up, she unintentionally joins the ride and protects his addiction. A wife felt relief when her husband stayed sober for 2 months. When he relapsed, she felt like she had been tricked. It happens, it's more common. Addicted loved ones will leave rehab and say, Mommy, you know what, I promise you this. I don't want to do anything else. I don't even want any form of extended treatment. I'm telling you, I've learned changes is the best. Changes that this. I've never got this, experience or this learning elsewhere. I'm telling you, I got this right. I'm gonna follow my 12 steps. I'll do my 5 pillars. I'll go to meetings by tonight. I'm telling you, but eventually they don't follow through with that. And then we know what usually happens when they don't follow through with that. Relapse then takes place in most cases. And when that happens, then you are likely to stand to have these, feelings and thoughts of like, okay, I think I was tricked. And then, as I've said, there, it's still one example. She said, I don't know if I can trust anything anymore. So it means now you are likely to start even losing hope in recovery at large, losing hope in your addicted individual, because then in that process, what happens is you're also losing yourself in that manner. We can proceed to the next slide. Okay, so now we're just going to talk a little bit about the emotional toll on families, of which is what I've actually sort of like some of them did explain. The roller coaster takes a heavy emotional toll. Now we're looking at the first thing is exhaustion. It is really exhausting to always want to care for your individual, to always be there for them countless times, especially when they've been in and out of rehabs, in and out of recovery facilities. It's really, really a big thing, which is constantly on the edge. So basically, what happens here is when we see family members ending up, I like to say, losing themselves in the process. What do I mean by that? You stop really much caring about yourself. You start doing things that brings you joy and happiness. You are always preoccupied with just wanting to help your addicted loved one. Anxiety is also a big thing because you never sure what will happen next. I think this is more like self-explanatory because you are always anxious. Okay, sometimes this is even possible. We even see it in the slightest of things when an addicted loved one says, "Okay, I'm going to the store. I'm going out. I'm going." Already, you are anxious because then there you're already asking yourself questions. Are they going to, pass by to a specific sport? Are they going to relapse? Are they going to take substance? Are they going to come back in full peace? Etc., etc. Am I going to expect, or am I going to experience some form of problematic behaviors when you come back home? Guilt is also a big thing, especially if you are a parent. I'm not saying it's not when you are not a parent. But the bigger thing is believing maybe it's my fault, because this is where now you sit with a lot of emotions, sit with a lot of thoughts, and then you ask yourself, did I do wrong in raising with this child of mine? Did something just not go right? Did I miss something? So you start questioning a lot of things. And in most cases, then the blame tends to go inward, because as a parent, there's a lot of expectation. You need to be seen as a great mom. You need to be seen as this mother who's loving, this mother who raised these kids well, this mother who sent their kids to the best schools, kids doing well. There's the guilt part of it becomes so severe and so there that most of the time then leads to the anger and the resentment. Most of the time, it's actually also too within ourselves, as much as we're angry towards the addicted loved ones. There is a lot of anger within ourselves, a lot of resentment, and now we're sitting, okay, maybe we should have done that. Maybe I shouldn't have done that. And then we're looking at things like shame. Shaming basically speaks to what I've said, you worry what others will think. Most of the time, if one has a loved one or as a child who's in a rehab facility, we then try to hide it, because there's still a lot of what stigmatization around it. So there's still a lot of things. If this and this know, what will they think about me? What type of a person I am? And then the hopelessness comes, especially when relapse feels endless. This we've seen also with some of our patients that have been in and out of facility, when now you find that at the beginning they had, just gonna now say it, just gonna give a very unrelated type of a number, but let's say they had all family involved. Maybe there were 10 family members who initially came with them to rehab. It was the first time, everyone is excited, we happy you doing this, you're gonna get better, etc., etc. And then as the constant relapses happens, and then they come back to facilities, go out, comes back, facilities, go out, you reach a point where now you realize that now when they come back, now there's only one person involved or one person left. And then when you try and ask, you find that even the person who's actually left is not necessarily someone who's within the family. Maybe it's a close friend or anyone else, or a close relative who just decided to say, you know what, man, I still have faith in you. So that's when this hopelessness comes, because then you start to sort of like backtrack and be like, you know what, I've had enough. I've sent him or I've sent her to 5 rehabs now. I think now I'm done. Person is just not going to change. I did give an example. Parents stop attending social events because they fear being asked about their son's rehab progress, especially if there is no progress that is notable. And then their world shrinks to the addiction. So you become so consumed that you don't even want to be exposed or find yourself in public spaces where you might potentially be scrutinized or be asked questions in terms of, oh, by the way, how's Tom doing? I had Sello came back from rehab. How is he doing? Is he still a troublesome child? How is he doing? Is he still coping? There's just a lot of those things that actually takes a toll on the families as far as emotions are concerned. I'm not sure if Tom you want to add, but I'm happy if we can proceed.
I think just something I wanted to add is, I think Settl's pretty much touched on it quite nicely, is that this roller coaster explains addiction so nicely, because it really is very up and down. Like, you gain hope, then you lose hope, then they do well, then they don't do well, then you blame yourself, then you blame others, then it's very sort of up and down and left and right and all over the place. And I think this roller coaster really does explain it incredibly well. And I think a lot of the time the biggest one that I see is the guilt that families feel, because they believe like I've done something wrong or it's my fault. I think that's the most common one that I do see when we look at the toll that it has on families.
Okay. Okay. So, sorry, now we basically just looking at the secondary impacts of the roller coaster. These are sort of like the effects that comes after the initial type of impact that is actually experienced, where everyone can see and can name it. So usually then what happens after, when one is actually stuck in this roller coaster, because it just keeps going on and on, there's a lot of ups and downs, as then we start to experience relationship strain. What does relationship strain actually entail? So here it's basically about arguments about helping too much or not helping enough. That's when now you find a loved one being in this position and saying, okay, you know what, this is actually how I've been doing. I think I've just been helping too much, maybe to a point I was even enabling the individual. Then now the question is, do I then just stop? Or do I then just try to tone down in terms of how I was actually doing? So then you find out now in terms of the relationship, whether it's a parent to child, wife to husband, there's starting to be some sort of imbalance, or they start to sort of like be some impact. And then sometimes the addict level might be like, yeah, you no longer even support me the way you used to. You no longer even do this these days. You just say, go. You no longer go with me. Even just minor, small little things, it's things that then comes as a secondary effect. And then, of course, children mostly are affected growing up with inconsistency, broken promises, or neglect. We know what real addiction takes. So addiction is more like we always say, I think it's a selfish disease. So it's all about me, you. So you find that if you are a parent and then you have kids, most of the time what happens is you are likely to have all these promises and never fulfill them. As I've explained, I think before, that you start with these broken promises. Sometimes you really literally even neglect your child to go and feed your addiction. We've had patients here who tell us really that they just leave their children to go get their fix and then come back after an hour or two. So basically, that's leaving the child unattended. Sometimes you can even be shocked. You find that the child is even like 5 years old, and then you ask yourself, how is that even possible? You know, in that space, you see the danger that you actually put your child to necessarily go get your fix and come back. In your mind, at that time, you're saying it's just an hour, it's just 30 minutes, I'll be back. They'll still be fine. They're in front of the TV watching, but we know what actually can happen in that time. A lot really can happen. Finances strained out, bailing out, paying debts, or even losing savings. We've had individuals who have even stolen money from savings to feed the addiction without the other partner knowing, and then it just created a whole lot of chaos. The relationship strain came up. Health problems, this year, we're looking at stress related illnesses. We're looking at things like insomnia, really not being able to sleep because of this stress or this constant need to always be worried. Okay, what is happening with him? Is he even here? Is he back? Whatever the case might be. We have a lot in terms of loss of joy. Families stop celebrating milestones for fear. Um, Relapse will ruin everything. This is also quite very common. Where now some celebrations even become stopped, or they become halted or minimized, because then it's a matter of saying, sure, we just don't know what's going to happen here. If we then just tend to throw this huge party or whatever it is that we'll be doing there, we don't know what can happen there. So we really now try to scale things, try to change how we normally do things to try and accommodate as best as we can. And that sometimes can actually take a lot, because it means sometimes we are depriving ourselves of what's supposed to be done there. So I've put down, I think it's just one example. I said, a mother says, I could not even enjoy my daughter's graduation because I was terrified my husband will show up drunk and embarrass us. That's quite a very powerful statement. A family stopped going on holidays because every trip was ruined by relapse drama. Even the children began to expect disappointment, because we know what happens. There's always promises, but they are never actually really fulfilled. We can proceed. Okay. Now, what are the hidden themes in the roller coaster? So, if you look at this picture, it looks like they're going down water. I don't think that was sort of like the plan, but the idea why I had that was to really try and show that there might be some of these themes or some of these impacts that are actually not necessarily as clear, as obvious as seen. Yes, when I explain them on me, when you look at them, you're like, oh yeah, I think I saw that, I get that, but it's not something that is immediately as direct and be like, okay, I know this is actually what's happening. Trust issues. I don't know when they are telling the truth, because now you've always been in this cycle. Let's say maybe they've been into facilities 5, 6, 7 times. Now the eighth time saying, you know what, I promise you, I swear to God, I'm going to change. Now the big thing is you're going to ask yourself, what then is different about this time? Are they even telling the truth, or this is just part of what do they call it? It's part of the tune, the same song that I've been hearing over and over again. And then in that way, you start even questioning yourself: is it even worth it for me to, offer this support? Is it even worth it for me to assist as best as I can? The trust issues then also is being affected. Fear of relapse at every happy moment. Even when things go well, the family holds their breath. We know what they say about too excitement and too enjoyment. Sometimes they could actually have a potential more sort of like harm or impacts that comes as a result of being too happy. Yes, we've seen it happen. Just being too happy can actually also have some form of negative elements. Over control versus helplessness. Family members, family members swing between micromanaging the addict and giving up completely. Role reversals, children becoming caretakers of parents or siblings. That's actually quite a powerful one. Do you have anything to add, Tom?
No, I think you've covered most of it. Can you hear me?
Sure. Okay. Sorry about that. I switched off. Okay. Yeah, we can move to the next slide. Okay. Now, the big question is, how then do we really step off this roller coaster? Okay. So families cannot cure in inverted commas the addiction, but they can choose to stop riding the emotional waves. But then how then do we sort of like do that? First thing, sorry, is you need to be able to name the cycle. You need to recognize when you are pulled in. When now you see that, no, man, I think this has just been happening. I think this roller coaster has just been turning, but we don't seem to reach an end or some level that we actually need to be in. Setting emotional boundaries, separate your feelings from their choices, because at the end of the day, they still had a choice to make. And then it's you still have a right to protect your emotions in that space. So to avoid yourself from experiencing what other presentations talks about, compassion fatigue, which is basically just the tiredness of caring, detaching with love, care without controlling or enabling. I think maybe this is also where the elements of tough love or anything else comes in. Being consistent, so you avoid swinging from over helping to total withdrawal. So here, basically, what's saying is you just need to be consistent in terms of how your approach and how much of the assistance you sort of like try to put in to avoid being in that space where you find yourself there or over assisting, and then the next thing you're just back, and then you just sort of like leave them like that. It's like you just drop something there and you be like, okay, now figure it out. But you need to be consistent in terms of how you're doing. So if there is consistent consequences that are always put in place, then they need to be put in place. There shouldn't be a time where you find that, okay, you be like, okay, no, for this one I'll just try and step in and assist them. But it needs to be sorry, consistent, so that whenever it happens, they will then remember that this is actually the thing that is sort of like happening. Focusing on your focusing on your own recovery. So there is a lot of emotional investment, as I've explained. There is a lot of emotional difficulties that you might experience as a loved one of someone who's addicted. Then what happens here by saying focusing on your recovery is it's always an opportunity for you to be able to either go to therapy yourselves, to support groups, self-care, like what you guys are doing now, which is a great thing to be in this space where you are also able to be assisted in terms of actually how you're feeling or whatever it is going on inside of you. In doing so, it's easier for you to sort of like be able to lend a hand, to be able to assist. The trick here is we don't want you to end up being stuck in the same roller coaster while you are losing yourself. Then it means eventually we have individuals who are actually just going without basically a direction as far as recovery is concerned, because both of them are actually sort of like lost in terms of how they understand how they are actually affected. So, example here, I did say a father decides, I will always love my daughter, but I will no longer check her phone, track her movements, or even pay her debts. That's her responsibility. Then that's when we bring in things, a lot of things like accountability, responsibility. I think it's what I was trying to refer to, and I spoke a lot about consequences, where then the addicted loved ones need to be in a position where they are able to say, okay, here I did screw up, I did mess up, but it's my own mess that I need to sort of like clean up after. And in doing so, you're actually helping yourself also and be like, okay, you know what? I love you, my child, but I've been telling you this, and now this is it. You have your own debts. You have whatever it is that is happening on your life, you can take of it now. So then you sort of like give them that responsibility, give them accountability to show that every sort of like that behavior has some sort of like reaction that is actually there. I'm not sure how we can proceed. Uh, okay. So these are like most of like a practical examples of what I was explaining. I'll just read through them. Look, this is just something that I just put down. I did say the first one is instead of I feel happy only when you're sober and destroyed when you relapse. I understand those are harsh words, but we can try and reframe them into I love you, but my happiness can't depend only on your choices. So basically, there you are actually trying to say, at the end of the day, since you made a choice, there will be a specific consequences. You cannot expect me to always be either angry or happy depending on your choices or any decision that you make. Second one, I did say instead of I'll pay your debts this time because you are trying, rather, we say, I want you to succeed, but I will not take responsibility for your debts. That's where accountability, sort of like teaching education, start taking place. And then the last one I did say, instead of, if you relapse, I'll stop speaking to you forever. We've heard these words quite a lot and be like, yeah, if you there, then I'm done. You'll never hear from me. I'm cutting you off on everything. But rather, yeah, we can reframe and say, I will support your recovery, but for example, if you use at home, you cannot live here. So you are really trying to show them and give them that bit of accountability and responsibility, and maybe to some extent a little bit of a consequence, so that they understand that they're actually their behaviors are sort of like not necessarily unacceptable. We can move to the next slide. Okay. Coping tools for families. This is very much generic. Learning realistic hope that accepts setbacks as part of recovery. Sometimes we are so hopeful that my child, my partner is going now to rehab for a third time. I know what they say about the third number. I know what three times mean in whatever it is ideology I believe in, whatever. I'm telling you, this is it. Once they come out, then they will be actually be proper. Everything will just be perfect. Everything will be smooth sailing. But we find that in most cases that actually different. Even in our conjoints, we try and stress, these things to be like, just be honest as well. The second one, in terms of what's your plan, how do you plan about it, and we also do ask families to also just jump in, ask questions, try to really understand what do they mean by saying, I will wake up at 7 and do this and attend. How does that entail? So that you actually sort of like have this bit of an idea and understanding in terms of, okay, these are the steps that are being taken. But then it doesn't mean setbacks won't be possible. It means whenever setbacks then are possible, if only as part of the conjoint, as we always say, the second conjoint, we say the addicted loved one, the addicted person needs to always, ask the parents or share with them how they can support them, so that if maybe they sort of like fall short, experience a specific setback, then it's easier for them to go to them and say, hey, I think here I'm lacking a little bit. Do you mind assisting me? So then you're trying to be more realistic in terms of how you sort of like envisioning recovery to take place, which is why most of the time when now you experience these setbacks, families then calls and be like, yo, I don't know what to do. Saying it's just a lot of things that really takes place there. And be like, yo, I don't know, I'm panicking. She didn't come back last night, or she came back drunk. I don't know what must happen. I thought now everything will be fine. What must I do? Who must I call? Am I bringing her back? There's just a whole lot of things that are actually there. But I'm thankful that you guys are able to attend this and you sort of like get this basic tool. But the idea that I'm trying to emphasize is just having that realistic hope. Realistic hope means you accept that setbacks are part of recovery. But then it's your role to be able to understand and be aware and be able to be in a position where if you can help, then you are able to help. And then joining support groups. Um, it's basically like what we're doing now, to try and understand more, get one or two things that can actually help you as a family to continue prioritizing self-care. I'm sure most of the presentation speaks about it. Self-care can include hobbies, exercise, spiritual practices, etc., etc. There's a whole lot of things that sort of like are fulfilling and sort of like makes you to be this complete individual as you know yourself, despite everything that is actually happening. You are still able to cope with them, deal with them without actually losing yourself in the process. Talk openly about feelings with safe people. Safe people really can be anyone that you really feel safe. I know what they say about the word trust, but really just being feeling safe and being able to open and express and say, hey, you know what, I actually now no longer what to do. I think this has been going on for years, and now it's a problem, right? A family recovery plan for how you respond to relapse. Most of the time, this you can even do it when patients are still in and your addicted loved ones are still in primary, prior to them coming up. You can already just have this plan in terms of if things then fall short, how then do I react to that? How then do I respond to that? How then do I sort of like deal with that? I just gave a bit here of self-care example. I said a mother began painting again after years of living in chaos. She said, even if my son relapses, I won't lose my whole life in the process, which is actually a big thing. So hence I say that's why it's in bold there that prioritizing self-care then becomes like some sort of a big thing. I think we're approaching our last slide, Dom. We can proceed. Okay, so these are like some of uh, reflections that I want you guys to sort of like have in mind. Maybe those who can share one or two can just share based on this. So basically, here it's asking yourself, when have I experienced the roller coaster of hope and disappointment? How has this cycle affected my health, sleep, or even relationships? What boundaries could I set to reduce chaos, or what boundaries have been set to reduce chaos? Am I living my own life or only reacting to theirs? So then that means it's coming from their choices. What does stepping off the roller coaster look like for me? How did you sort of like deal about it, or how did you go about it? If not yet, then where are you at as far as the roller coaster is concerned? I think we can move to the conclusion slide. I'm not sure if there's something, then we can come back to this one. Okay. So I did say here that remember, addiction is chaotic, but your life doesn't have to be. Families can step off the roller coaster by summary, holding wise hope. So the wise hope is the realistic hope that I talk about by accepting that setbacks are possible, loving with boundaries, tough love, living their own recovery. So this is your own recovery as a loved one, and that means speaks a lot about self-care and everything that I've mentioned. And then I did say that your steadiness is the strongest support you can offer. And of course, my quote there is sometimes the hardest thing and the right thing are the same thing, are the same. So you can go back to the reflection slide. And then I'm not sure if you want to add something, Dom. And then yeah, I think maybe one or two can maybe reflect based on the questions. I thank you.
Thank you so much, Sello. I think this has really been a good presentation, and kind of makes a lot of sense when it comes to the chaos that comes with addiction. It's not really just about your loved one being addicted. It's not just about one person. It actually affects everyone. The enabling, the parenting, the switching roles. It's a very good presentation in highlighting that chaos. So yeah, I think, I don't know if we should, if anyone's got any questions, you're welcome to add, or if you want to share your experiences, please do by lifting your mute button if you would like. There's a question, and I don't know, maybe we can both answer it. Is it normal to feel fear and anxiety when your loved one is coming home after their first time in rehab? I think it is very normal. There's a lot of trust that's been broken. There's a lot of chaos that's been created. There's a lot of damages that have been done. And I think it's that anxiety of like, is rehab going to be enough to get them on the path of recovery? Have they learned enough? Have they worked on themselves enough? Do I need to walk on eggshells? So I think it is very normal, but I think if you kind of look after yourself and you go through with your own family support process, and you learn about setting healthy boundaries and how you can sort of manage your cope with the situation better, it's also that's something that's very beneficial for you. Cyril, I don't know if you want to add on to that.
Yeah, look, and I think you actually quite spot on. Um, I think really it's very very quite normal, and I think it's just one of those feelings that you will still experience no matter how long they've actually been into institution. Because I think it speaks a lot to just, I don't want to say fear of the unknown, but the fact that now they are coming back, and then how then do we do this life thing? literally, if I can put it that way. There's going to be a lot of adjustments. There's a lot of shift that takes place. Sometimes you even wonder, are they going to be the same person that they were before addiction starts taking place? Because there's a lot of things so there's a lot of changing in behavior. There's a lot of uncertainty in terms of, okay, then how do I do this? Do I even now allow them? How do I even support them? Because I think that's also a big thing. How much of to not support or to support must I be there? So just finding really that balance is quite nervous. Okay, they're coming back. Let's say then they really do not go back. They are in recovery for long, but just navigating through that. I'm assuming also at that time it's also something that's new to you as a loved one. So just having to find ways in terms of how you deal with it, navigate with it. It actually can be sometimes quite challenging, but it's absolutely normal. Absolutely normal.
Estelle, I would actually have said anxiety, fear, or mild words. I could say terror.
Yeah.
You feel terror when they're coming home. Particularly if we can't put them in a halfway house, then
Mhm.
we're going to go through that settling in and readjusting and the victim and the persecutor and the all the stuff that we deal with. Um, I've been going through this since the 80s and we didn't have halfway houses. And now the first thing was, you're going into a halfway house because we can't deal. We just emotionally are tired. So yeah, very normal.
Yeah.
There's another question that says, when stepping off the roller coaster, is it normal to feel that setting emotional boundaries could make it feel like you are withdrawing?
Hmm.
Good
Absolutely.
question.
Yeah, it's a very great question. But I think, yeah, it is absolutely normal. My team can just jump in there. Basically, looking at the fact that, remember, you become so emotionally invested. You really are there by any means necessary. Any second of your life, you are actually really there to support and trying to make
Mm.
sure that they get the best necessary assistance or whatever it is that you actually are there. So now, when you're setting an emotional boundary, of course, it's more also
Mm.
about protecting yourself. So when that happens, it means then it's sort of like you know what a boundary is, sort of like there's something that just steps in and like, okay, you know what? I think now let me also get my own sort of like space, my own recovery. So then it means you're no longer invested as you were before. So it means there's this sort of like this distance that then starts to be created. And of course, that distance then can be actually what we refer to here as being withdrawing, basically, because then you are trying to shift just a little bit. And I think the more you do that, the easier it is for you to actually be in a caring position. Because then in that process, you are actually at a space where you now are sort of like not necessarily losing yourself. You are sort of like, let me say, re-energize. You are now sort of like even to learn more. You have the capacity to be like, okay, let me find out more about this thing, or let me just simply take care of myself. And then if then you are in a best and perfect position yourself, it's easier then for you to be in a position where you can assist. Because then now the danger is if you continue to just being a maneuver for this closeness, as we always say, and you're always like this, that means you end up losing yourself in that process. And then when you leave yourself, it means you're potentially living their own life. And you know what happens: compassion fatigue, emotional outburst, then everything else starts taking place. But it is quite normal. It feels like you're withdrawing because then now you are saying, let me just step back a little bit, trying to actually listen and just hear what my body is telling me, what my mind is telling me, what my feelings are actually indicating. And in that
Mm.
way, it sort of like feels you're actually withdrawing. But really, it is a positive thing to do because then you're actually also trying to walk this recovery yourself to be in a position where you can be able to actually care and support for a deep loved one. But yeah, it is very much normal. It is very much normal, Sedira.
Mm. If I could add to that,
Yeah,
maybe it's about not really stepping off the roller coaster per se,
yeah,
but shifting.
yeah,
Because I think when we set a boundary, we still feel those emotional ups and downs of, are we doing the right thing? What if it hurts them? I can't do much more, but I have to try. And it's that detaching, I think that Silla was talking about. I think that I can tell you, it still feels like when I'm making a tough decision, it still feels like I'm on an emotional roller coaster.
Mm-hmm. Yeah. Yeah.
There's another one. When you reach the point of giving up or exhaustion, how do you recover from that while showing love and care for your partner when everything is always about their chaos? I think this is where like boundaries that you set for yourself are very, very important, because it's so easy to get caught up in the chaos. And I think it's best that, you kind of set those boundaries for yourself and say, and not allow yourself to get caught up in the chaos.
Mm-hmm.
Because otherwise you're just going to drag us. Because I mean, when we enable and we're trying to rescue and we're trying to help, we get pulled into this vicious cycle, and it's like sometimes it's really difficult just to get out of that.
Mm.
And I think you can
Sorry.
speak, Shelly. You can speak.
I don't think we should worry about that. That if we are exhausted and spent and done, that we should be worrying about their needs. Sometimes that's the catalyst for some addicts, when their families actually say, you know what, I can't do this anymore. And when they feel that and they realize that, sometimes those are some of the consequences that they need to look at themselves, realign. So please don't worry when we start setting healthy boundaries of I'm going to take care of myself. Addicts have maybe, I don't know, hundreds of thousands of NAAA meetings around the world. They have got potential sponsors and counselors and rehabs, and everybody's looking after them. Very few people look after the families. Very few rehabs even have family support groups. So it's okay to take the time to even ignore their needs. Tell them to get their behind to a meeting and get their sponsor on board. The quicker we get sick and tired of being sick and tired, I think the quicker we help them.
Mm. Mm. Yeah. Yeah.
I think Zuleka also just made a comment that it's very difficult to detach when in the same household and the chaos is just there.
Mm. Mm. But I think those are choices that sadly we make. Because of fears and all the stuff that Sello spoke about earlier in the presentation, I think that's why we give in and why we enable, because we're on that roller coaster of, are they going to die? Are they going to lose their minds? Are they going to hurt somebody else? And I think we're all too politically correct with our addicted loved ones.
Mm.
If I had to walk into any of your homes tonight and leave a mess, eat all your food, swear at you, smoke in your house, get drunk, how long are you going to keep me? I'm hoping you're going to say 10 seconds. But because they're our loved ones or our children or our husbands, wives, family members, we just put up with it. And we don't have to. So recovery for the family is that we are empowered to make decisions that actually work for the family. We shouldn't be just pandering to their needs. It's a very fine line, and unless you're very skilled, you're probably going to be doing it wrong.
Mm.
So think about a stranger. If this person that you gave birth to was introduced to you today, would you invite them into your home and let them take advantage of our kind heart, our hospitality, our financial situation? The answer should be no.